bet. Hey there, I'm Jay Skinner. This is the Buyers and Sellers Show. We get started a little bit early and let everybody have a chance to get on. The topic today is Snore No More with Dr. David Isaacs, thesleepbetterguy.com. Oh my gosh, how about that? Thesleepbetterguy.com. And I don't care where you are in the world today, you're going to love this. Summertime. You're on the Buyers and Sellers Show right now. I'm Jay Skinner, and we're waiting for everybody to get on. We start at 10:35 Eastern Time. That's the same as New York. I'm in Indianapolis, Indiana. Hey, I'm Jay Skinner, and this is the Buyers and Sellers Show. We're going to have Dr. David Isaacs with us today of SleepBetterIndy.com, the Sleep Better Guy. And we're live. How about that? And so what are we going to do right now? I want to say hello, everyone. Dr. David Isaacs is going to be here, and you're on the Buyers and Sellers Show. And so what's this got to do with buyers and sellers? Well, let's just remember a couple of things that we know. The silver rule is do unto your vendors as you want your customers to do unto you. And then the green rule is do for yourself what you're asking others to pay you to do for them. Now, we've got people on board right now that are entrepreneurs, people that are just saw this and said, oh my gosh, this is very interesting. And so without any further ado, I'd like to introduce you to Dr. David Isaacs and bring him out of the green room. Okay. And there you are. Hi, Dr. Isaacs.
Hey, Jay. How you doing?
Fantastic. How are you?
Awesome. I'm great. Thanks for having me.
Good to see you. Today, we're talking about your business, Sleep Better Indy and Isaacs Family Dental, that's headquartered here in Indianapolis, Indiana. And we want to get right into it. For the people that are watching, in a minute after Dr. Isaacs talks about going into business and the growth of his business, we're going to get into very much specifics about snoring and breathing and dental sleep medicine that will be interesting to you. We're 30 minutes up and down, so away we go. Dr. Isaacs, tell me about going into business and a little bit of history about your company.
Okay, well, I graduated from dental school in 91, so I've been doing dentistry for 31 years now. I've had an office on the northwest side of Indianapolis for most of that. I have a great team around me, so I want to give a good shout out to them, as I appreciate everything they do. I can't do without them. I've invested in technology through the years, just staying up with what's going on and different treatment modalities and delivery mechanisms. So
While you're talking, well, let's show some pictures here. Um, I've got this is from your webpage. It's a very family friendly, great place to go. And I've been everybody needs to know I've been a customer, a patient of Dr. Isaacs for about 15 years, and I'm also a through my CEO extender program. He's also hired me, and I've been doing work for him and his practice for a number of months. And I'm proud to be directly and professionally associated with Dr. Isaacs too. So that's cool too.
Hmm. Yes.
So looking through here, there's just tell us a little bit about what we're seeing.
Well, this is the entrance to the office here, and then this is my team that's helping me do what I do. And there's the front office area there where our patients come in, and that's a look down the main hallway once you get through the front doors and through the front entrance there. We tried to make it inviting and not have it look so much like a typical dental office.
It's pretty modern. As when I go there, it's like I end up sitting down there, and it's like the first thing you do is hand me a remote control so I can watch TV. What's that about?
Right. We have TVs in every room. There's a monitor that's on a multi-arm TV mount that we can project information on there, so we can discuss that with the patient. And when that's not going on, the patients can relax and enjoy TV if they so desire. And we have Sirius XM radio too if they want to listen to music.
What about? I'm thinking, as I recall, don't the chairs vibrate too?
They do. There's a massager.
I
There's a
love it.
massager in the back, lower and upper back massager. So a lot
That's
of patients
pretty
like
nice.
that. And
That's
it doesn't
good.
beat you up. It's gentle.
This is the experience. There we go.
Mhm.
And then the modern. I mean, you're
Yes.
doing some special stuff here with 3D imaging and so forth. What can you talk about some of the modern techniques that you're using now?
Yeah, we have digital X-ray, and so the films are digitized, and the machine you saw there is we have digital intraoral scanners. So we typically don't do impressions so much anymore. They're done through a digital camera. And for people who need people who need work crowns, and for instance, we can make those in the office through the digital process, and we have a CNC machine that mills the crown there while they wait. And that's where the TVs come in, and they can do some work while we're making it, and then we'll watch TV, read a book, whatever they want to do, and
Cool.
we'll make it, and it's a one trip visit.
That is great. And I gotta say, I've experienced it. So generally you don't have to do those goopy trays and things anymore because it's all done digitally.
That's correct. That's correct.
That is really cool.
Mhm.
Let's see if we got any visitors here. Let's see. There's a Tom Ginn. There you go. Well, Tom Ginn is a friend of mine, and I'm glad you're here, Tom. He said, "Good morning. Good morning to
Good
you.
morning, Tom.
Glad you're here."
Yeah.
And look at this. Somebody's already jumped in here, says, "I've been putting tape over my mouth when I sleep to stop snoring. Seems to be working. Am I crazy?"
No.
That's a good question. Go ahead and address that. What do you think about that?
Well, part of the problem with snoring is muscles relaxing and your mouth opening up and your jaw falling back. So if part of the treatment process is keeping the jaw closed as much as possible, because that helps. So if you're using tape to keep your mouth closed, then that definitely can help. So you're not crazy. Okay. It can be effective.
There we go. Hi, Lana. Lana, good morning. Good to see you here. I'm glad you're here. I just want to encourage everybody to feel free to post a comment, say hi, ask a question. This is a great time to do that. Let me click. There we go, like that. And I'm going to put a comment here in so you can see just where I'm going to post a comment. This would be www.sleepbetterguy.com. That would be Dr. Isaacs. And if that pops up on your, if that can pop up on your screen, you'll know where to go to see him. And let's see who else is here. Let's see, we got that. There's where you go to get a hold of Dr. Isaacs. And look at this. Ha! What? That is an interesting last name. Who's that?
Hey, I think I know her.
She says, I don't like a CPAP machine. What can you do to help me with my snoring? I think that's Mrs. Isaacs, isn't it?
Yes, it is.
Welcome, Karen.
Hi, Karen.
So glad you're here. And we're going to talk about that exactly in just a minute. So
yes, we will. We will address that.
Mm-hmm. Sharon Skinner, this is my niece. Good morning. Now Sharon has gone 916 consecutive days live for her business, Reveal Products.
Oh, wow.
And every single day, never missed a day, weekends, whatever it is, does it all.
That's
and congratulations, Sharon. I'm so proud of you.
Mm-hmm.
And her website is thesharonhoffmeister.com. thesharonhoffmeister.com, and go there and see what she does, and you'll be glad. Let's see. There's a guy. Do you know Dr. Lee Osler, DDS, author of Redox Matters? Does that ring a bell to you?
No, it does not. No, it does not. I can.
Tom, you can feel free to share some information with Dr. Isaacs. At the end, we're going to be putting up his information, or you can go to his website and connect that way too.
Yeah, we'll leave my email. We'll leave my email up. Then he can send that if he wants to.
So let's get right into this. I'm gonna put in this. There we go. And we're going to get right into the crux of the matter, which is the snoring, the sleeping. And I'm going to stop talking, if you can believe that. And let's let Dr. Isaacs talk. Here we go. Boom.
Okay.
And you can, since I'm punching the buttons here, you can let me know if I need to change the slide.
No, yeah, just leave it there for a second. I just, the reason I started Sleep Better Indy is I'm a snorer, and I received treatment for that through an oral appliance. So I've been successfully treated with snoring. So I wanted to start Sleep Better Indy and get into dental sleep medicine so that I can help other people with their snoring. And as we'll talk, we'll progress into dental sleep apnea, obstructive sleep apnea as we go forward here. And that's the reason why I started Sleep Better Indy. As I mentioned, my snoring has been about 6 years in duration. It never got to that problem. At least I don't think so. My wife could correct me if I don't remember, but I've been snoring for a while, and I've been successfully treated with the Oral Appliance.
Yeah, and I'm one too. I've got mine right here. I've been snoring for a long time, and I'm successfully treated also by Dr. Isaacs with an Oral Appliance. We're going to see that in a minute. There we go. Boom.
There we go.
Look at that.
So, yeah, so when we talk about snoring, you say, okay, what exactly is snoring and how does it happen? So when we fall asleep, all the muscles relax in our lower jaw and face. So our chin tends to fall back. And in snoring, the airway starts to get plugged to a certain degree. It doesn't get completely closed, but the airway gets narrowed. So when we're breathing and the airway is narrowed, the speed of the air flowing through there in the back of our throat increases, and that causes the soft tissue to vibrate, and that creates the snoring noise. So everybody's snoring is a little different. Homer, obviously, Homer's a little bit over the top, and Marge is having a tough time here. So that's so snoring doesn't exactly affect just you. It affects your bed partner. So it's important to get it treated. And then with this slide, the blue represents airflow. In snoring, the airway is partially blocked or partially obstructed. Obstructive sleep apnea takes it a step further and completely blocks the airway. So that's when you may notice your bed partner not breathing and then suddenly gasping for air. And that's a serious problem.
Mm.
So we have the air is completely blocked, and that creates a lack of oxygen to all the tissues in your body.
So right now on this picture, this is showing breathing because it's open. But
Yeah.
what we're going to show is when someone lays down, I'm going to click it and you'll see, describe what we're seeing here.
So we're seeing the tongue. You see the tongue, the base of the tongue, and the pharyngeal tissues just kind of collapse back and completely block the airway. And that's what we call obstructive sleep apnea. That's a demonstration of that. So no air getting to the lungs. Your lungs are trying to breathe, but no air is getting through. So the person stops breathing.
Yeah.
And
that doesn't sound good.
No, there's serious consequences of that. There's heart arrhythmia, there's stroke, heart attack, increased risk of diabetes, brain fog. They're starting to, our brains, when we're sleeping, our brains do a lot of detoxification during that time. And if we're not sleeping, our brain isn't getting rid of the waste products, so to speak, that occur during metabolism when we're awake. So that can lead to morning headaches, brain fog, that kind of thing.
Yep. Peggy, thanks for coming. She says, "Hi, Jay. My husband has sleep apnea." Well, golly, my wife's husband has the same thing.
Yeah, it's serious.
So, and Karen Isaac's husband has. Were you sleep apnea or just snoring?
Just snoring. I tested normal for sleep apnea. So I wasn't getting completely obstructed. It's just the snoring. So my airway was narrowing, but not completely closing.
Yep. And I'm even worse. Anyway, Tom Ginn says, with interrupted sleep, our body can't do its restorative healing.
No,
came into that.
That's right. You wake up feeling tired. It's like, you don't have the energy that you need. So we just look at, okay, so how do we go about addressing the snoring in the sleep apnea? One option is to sleep in another room. That's not the best option for a variety of reasons. One, what if you don't have a guest room, right?
Well, if you don't have a guest room, then what?
Yeah.
It's not on the side.
The couch is uncomfortable, right?
Well, I got a guest room. I know that.
That's right. So that's kind of doing the burying the head in the sand thing. Some people have tried herbal remedies. You can try that. See how you do with that. Another option is talking to an ENT. ENT can evaluate your airway and see if there's obstruction there with the soft tissues, maybe being tonsils, and they can recommend treatment and see if they can help. So that's one way to go. The thing about that is, it's invasive, but they can evaluate that with you and decide if that's a good option for you.
And there's different. One of the things is that people need to understand, I guess, is that you're not doing something separate from physicians. This is in conjunction with physicians that you work together. Is that right?
Absolutely. We work with the patient's physicians, and we also work with sleep medicine physicians, and we work hand in hand and communicate with them as far as best treatment options for the individual patient based on their situation.
Yep. And so one of the things that happens through that process, sometimes people are on CPAP machines. Talk to us about that.
Well, CPAP stands for continuous positive airway pressure. And in the picture, you see the little silver machine on the nightstand there. And what that does is that controls airflow through the tubing to the mask that sits on the patient's face. And what it does is it generates airflow to through the tubing and then through the nose and then down the back of your throat to keep the airway open on that patient who suffers from obstructive sleep apnea. And with that air pressure, it allows the patient to sleep and get and get a good night's sleep. And CPAP works. It definitely works. The issue that a lot of people have with it is that there's some intolerance to it, whether it be the mask, just having the mask physically on their face, or the air constantly blowing down their throat and into their lungs. And I've read where a physician has likened the CPAP to driving down the road and sticking your head out the window. So
That's a great slide. That
yeah,
is
it
great.
is. That is. So that dog is receiving CPAP therapy there. But another, what I'm more familiar with here is the Oral Appliance. And this appliance is similar to what I've been wearing for the last 6 years. And how this appliance works, and Jay has an example of his.
Let's see. I got to go over here. For people that don't know, I'm running 3 screens and another one here and producing this at the same time. So if it looks like I'm looking around doing stuff, I am. There
Right.
we go.
Right.
Here we go. So this is mine
Mhm.
right here. This is my my Oral Appliance, my Miracle mouthpiece,
Mhm.
and my case that I got from Dr. Isaacs.
Mhm.
There we go. I'll put it up so
Okay.
everybody can see it. Look at that.
And what the Oral Appliance it does is it has an upper and a lower component to it. So an upper component over the upper teeth and a lower component over the lower teeth. And they are, the upper and lower components are usually connected one way or the other. And what we do is we use the upper component as a stability factor, and the lower component helps keep your lower jaw in place while you fall asleep. So
This is not a this is very easy because I do it.
that's right.
This kind of explains the effectiveness of the Oral Appliance dental sleep medicine, dental sleep therapy against the CPAP. And this is showing how when the lower jaw is put out, you have more breathing. But the CPAP is very effective.
Yeah.
What's the problem?
We just don't see ideal compliance with the CPAP due to intolerance and inconvenience of the mask and hose while patients are trying to sleep. They have to take it off if they get up in the middle of the night to use the restroom. It's a little harder to carry with you when you travel for work or pleasure. So the compliance tends to drop to roughly around 40% after 6 months. So that, in contrast to the Oral Appliance, it's just more comfortable and it's smaller. You just have a little more freedom while you're sleeping. So we see increased compliance with the Oral Appliance.
So I'm going back to Dan. Stay with us here, Dan, because you're starting to see what could be an answer for you.
Mm-hmm.
There we go. And then next thing is boom. What's this is showing something when you combine the compliance with the effectiveness, how the Oral Appliance is even better.
Sure. With the CPAP, it definitely works with 95% efficacy there. It's just the compliance drags down the overall effectiveness. I mean, it can work it can work great, but if you're not wearing it, that that obviously doesn't do you much good. With the Oral Appliance, so we have 75% efficacy with a very high compliance. So that raises the overall effectiveness up to just under 70% there.
Yep. And let's see what we got next. Oh, there we go.
Yeah. So so what it boils down to is, life's hard enough as it is. So getting a good night's sleep is going to make you feel better, give you more energy, uh, make you more productive. It just gives you a better outlook uh, on the day, so that you can have a great day, and it can be it can change your life in a lot of different ways.
It can. And when I'm going to click this and let's get back on here together. Um, what's what do some people experience by coming to you, and what's the process? Talk a little bit about what happens and how people can work with you. And then I've got people that are outside of Indiana, in other states, and even around the world. So how would we handle that? Maybe you can talk about the process where someone can investigate this and see if it's for them.
Sure. You can reach out to us. We have Terry is my sleep coordinator. We have physicians that we work with in Indianapolis. We also have physicians that we work with that can provide services via telemedicine, and they're licensed in multiple states. So we have sleep physicians who can reach out to others in other states. To try to get some answers to their problem. The process in our office is we like to bring patients in and do a sleep assessment, have them go over their symptoms, and we can get them in touch with sleep medicine physician here in our town, if necessary, or we can find somebody who's closer to them.
Now, people can get a hold of you, find you through this,
Mm-hmm.
The sleepbetterguy.com, sleepbetterindy.com. And at the same time, they can make a phone call. There's your email, disaacs@sleepbetterindy.com. So that's good. And I was up there earlier. And let's see if I have any more comments or questions from people. There's one right there. Let's see. Boom. Eric. Yes, sir. Welcome. He says, yes, sir. I could use this. I'm late to the party, but I'll definitely check the replay. Good morning. God's blessing to you, gents. Thank you, Eric. Good to see you.
Yeah, Eric, feel free to reach out to us.
Yes. And if we can't help you directly, we are here to help you find the answer, however it takes it.
Mm-hmm.
Doctor. Okay, I love Dr. Isaacs. He's like awesome. His bedside manner or chairside manner is out of this world. His people are wonderful. It's truly an experience, a good, positive experience from the time you walk in. I mean, even you call on the phone. These people are friendly. They're lovely. They're wonderful. Let's see, Mark Gassert. Hey, welcome. He says shared, so he shared the broadcast with his group. Thank you, sir.
Thank you, Mark.
And he says, excellent content.
Mm-hmm.
Thank you.
You're welcome. Thanks.
There we go.
Mm-hmm.
With that, I'm looking. I want to encourage everybody. You know how it is. If you put in a comment, it takes some time before I get it. And if you have any comments or questions, this is the time to do it. But at the same time, this is all confidential. So if you call that number and talk to Terry, it's held in total confidence.
Absolutely.
And Dr. Isaacs is here to help.
Yes.
Great. So with that, I guess we're just about done. Dr. Isaacs, I'm going to give you a chance to just talk a little bit about, as a wrap up here before you slip into the green room again.
Okay.
A little bit of a wrap up to explain to everybody their situation, how you can help, and what your thoughts are as we wrap this up. And hold on just a second. I want to do that. There we go.
Okay. Well, yeah, I just want to say if you feel like your bed partner is mentioning you're snoring, or they hear you stop breathing while you're sleeping, take it seriously because it can affect you in a lot of negative ways. So I encourage everybody to, if you're a snorer, reach out for help. Reach out to us. We'll be glad to walk you through the process, or talk to your family doctor so they can start you along the same journey too. But we're here to help, and I agree. I encourage you to look into this further and not put it off, because it can make a difference in how you feel by getting treated.
Super. And thank you so much for being with me, Dr. Isaacs, today. This was fantastic. We've had a good crowd. There were a lot of people watching that when you start talking about medical issues and things like that, it's kind of like, I have a friend and I want to ask a question. It's like, I
Right.
get it.
Right.
But everybody knows how to get in touch with you right now.
Yes.
And I don't care where you are, you get in touch with Dr. Isaacs and he'll help you find some solutions and help you get to better health, because this can be serious. And it's just something about falling asleep in the middle of the day that you shouldn't be doing. And Dr. Isaacs can help with that sort of thing.
That's right. You can maybe lay off the caffeine a little bit too in the middle of the afternoon.
Yes, I will try that.
That's right.
Anyway, thank you so much.
Thanks, Jay. Thanks for having me.
I'll meet you back in the green room, and please don't eat all the fruit, okay? Okay, everyone. Thank you for coming. This was a great show today. This is the Buyers and Sellers Show. I'm on every Friday morning live at 10:35 a.m. Eastern Standard Time. So much appreciate your comments and your visit. And then I know there's replays. And with all that, you guys are the best. And I really appreciate you coming and being with me today. So I'll see you next week. In the meantime, you can go on any of these channels and you can see the replays as well. I keep letting them pile up, and it's wonderful. I want to say thank you so much for coming. And let's see if there's anything like this. And let's see, Eric says he shared it. Thank you, Eric. And he said, play it, Daddy-O, slide me some skin. Well, what he wants to see is I'm going to play some Boogie Woogie. Here we go. Goodbye, everyone. Thanks for coming. Thanks for coming. See you next week. Bye now.